content of this podcast does not replace the advice of your healthcare provider. Individual cases and questions should be discussed with your own healthcare provider.
Thank you for joining us again for our S.H.A.R.E podcast. It is STI Awareness Month, which is a major issue. If you missed last episode, super important. Go check it out. Get a ton of great information from our lovely guests, our clinic director, Joe, and our nurse manager here in Oakville, Sue. I do want to point out the very obvious thing that is missing in this podcast. That's Cassia. She's not here. She went ahead and got married. We feel real sad about it, right, Lucy? Yeah, we feel real sad. Cassie, we hope you're having a great time. But come back soon, because we miss you, and I need your help. I need your help, Cass. But jumping back into our podcast, Real Talk. First question. I think my teen is sexually active. How do I talk to them about STIs in a way that they won't feel shamed? This comes directly from last week. I got a conversation with a parent, and they asked this question directly. So, for our nurses here at Atwell, how would you address this question?
Well, it says, I think my teen is sexually active. And like we said last week, how Sue spoke last week about the fact that assume that they're having sex.
Yeah.
So start at that point, as opposed to trying to figure it out. So assume it and then come with facts. You need to talk about facts. You just need to sort out what it is they're doing and with whom, and bring the facts forward so that they are well informed, and that with information is power, and that they can make decisions from there. It's really important to not bring your own emotions in, so not yelling and screaming and telling them no, they should never have done anything. If something's been happening, then they need to own it and move on from there and learn. So, but I like to, with S.H.A.R.E, we're getting to the kids sooner with a lot of information as opposed to after the fact. But, whenever you get the facts, then that's going to be an important part. And hearing them out, being patient, being calm. And if you're struggling with that, then we are happy to have the kids come in and speak to us, because we'll talk.
That's awesome. Any other thoughts on that, Sue?
Yeah, equipping yourself as much as possible. And as Joe said, then if there's things you're not sure about, or your teen is not comfortable talking with you, then certainly, we're here.
And that's so important, because I actually get that question a lot in the classroom of either my parents don't want to talk about this with me, or that we've tried and it just kind of has gone not the best. So as far as if a teenager wanted to reach out, say like a teenager is listening right now and they're in a situation where maybe they don't have that trusted adult to reach out to talk to, are they still able to reach out and talk to you guys as nurses here at Atwell?
Absolutely. We'd welcome them in, non-judgmental, just answer their questions, and hopefully equip them with what they need to make their best decisions.
That's great. So yes, if you are a parent or a teen and you are struggling with having these conversations, feel free to reach out to us at either Hamilton or Oakville, and our nurses are happy to talk to you.
One thing.
Yeah.
I was going to mention that we actually had a parent come in and go through a whole intake with us because he wanted to get more information for his son, who was 17, and he was pretty sure he was having sex. And so he wanted to have more information to share with him. So, parent wants to come in and talk to us, or you've got the S.H.A.R.E program too. It's an awesome place to learn.
That's awesome. That's so cool that like a parent felt I need more education and then just came in and talked to you guys and was able to go through that process. So that's one of the things I love about our program and about Atwell is that we provide safe spaces for people to do that. So again, if you're in that space, come talk to us. We're not too scary. Promise.
It's all confidential too.
It's all confidential.
Yeah.
So speaking of confidential, I got this next question confidentially. It's been in big letters. Anonymous 14-year-old. That was the name of this. Anonymous 14-year-old writes, "What's a pap smear?"
Good question.
Yeah.
Yeah, very good question. So pap smear is it's something that is done by a family doctor for any female. In Ontario, I believe it's any female who has ever been sexually active. So it doesn't mean she has to currently be sexually active, but has ever been sexually active over the age of 21. And she should have it done every 3 years. And so it's done with a family doctor. And what they are doing is they are testing for cervical cancer by going through the vagina, using a speculum to open it up, and taking cells to be tested right by the opening of the cervix. They are taking those cells and they're tested for cancerous and precancerous cells. And again, just if it's caught early, then it can be treated.
Now, my question, thank you for that, first of all. Very, very succinct, very professional. That was great. I feel like I know more things.
You learned something
I
today.
learned something today. Are there STIs that would contribute to like cervical cancer, for example, like that if gone untreated, could be a contributing factor?
Yes. HPV is the leading cause of cervical cancer. I believe 90 to 95% of all cervical cancers are caused by HPV. And that is one of the most common STIs that people are carrying around. I believe it's around 50% of people that have been sexually active are carrying it and would not even know it.
I think it's even higher than that. I think it's closer to 70%.
Okay.
70% have had HPV in their life, never known it, and it's never affected them. So that's why we don't test for it. There is a vaccine that is used, given typically in grade 7, 8. That is used to prevent it. It used to be only to girls, and they've extended it past that.
Does our clinic test for HPV?
We do not.
No.
Okay.
No, but yeah, as Joe was talking about, the Gardasil, it's the vaccine that is used for 9 different strains of HPV. There's over 100 different strains of HPV. About 40 of them are in the genital area, and this guards against 9 of the leading causes of cervical cancer.
That's amazing. And there's a vaccine for this. So you can get tested, treated if you have it, and then vaccinated.
Right. Some HPV only causes, it can be asymptomatic. Some can cause genital warts, and then some just, I think it's 13 of the strains can cause cervical cancer. So the Gardasil 9 is preventing about 70% of those. Yeah.
Great information to continue to like just think about, STI awareness and how to prevent. So another question that we get that I got actually earlier today in a presentation. Does contraception protect against STIs?
Good question. So contraception comes in many different fashions. The only one that would decrease the risk factors are condoms. And condoms, so male condoms, female condoms, and dental dams. So those can help prevent it. It's not 100% as far as preventing any STIs, but it is a very high percentage. But they have to be used every time, always. It's not an on and off kind of thing. And public health also advocates using lubrication with them, because what often happens is that they can break or fall off, and then you're still exposing yourself. So, birth control pills do not prevent you from getting any STIs, nor do any of the implants or patches. It's only a barrier method that's going to help prevent STIs or abstinence.
Yes.
Don't have sex, you're not going to get an STI.
Yes. It's the only 100%.
Oh, the only 100% way.
Yes.
Very true.
Yep.
So with when we're talking about screening for STIs, like when is it important to get screened, and when should it happen? When should it happen? Should it happen before you're sexually active, after you're sexually active, during, all the above? Like when should people be like specifically like, okay, this is my window, this is when I should go and get tested?
Well, if you've never been sexually active, then there would not be a need for STI screening. And when we say sexually active, that can be beyond vaginal. It can be vaginal sex, anal sex, oral sex as well. So some STIs are passed orally even. So if you have not been sexually active yet, there'd be no need. But your partner may have been sexually active, so it would be important for them. Whenever a new partner is introduced after that initial partner, it's important to get tested because you don't know. And every partner that they have been with, it could possibly be spreading something to yourself. So, yeah. If there are multiple partners, the public health would suggest every 3 months. If you're not using a condom, that's putting you at greater risk, obviously. Certain activities, multiple partners or anonymous partners would put you at a higher risk as well. So I think you need to know your risk and work within that. But I always suggest for any clients that come in, if they are about to embark on a new sexual relationship, that both they and their new partner should have the screening done prior to beginning that.
Yeah, I agree. I think it's going to come a point in time when people are saying, show me your papers and I'll show you mine.
Yeah.
Because, people are becoming more aware that there are so many different STIs out there and that they could be infected. Unfortunately, there are still people who think that, they're of a certain age, something like syphilis that they thought was long gone, and now it's surging across the world.
Really?
Yeah. Congenital syphilis is one that is passed from mom to baby, and that can be very devastating. And what's happened historically, it was mostly men that had syphilis, but it is definitely now with women too, and often with very few symptoms, so they may not realize it. So that's why it's so important to get tested between partners and looking at that 3-month window. But also, if you have symptoms, if you do have any kind of symptoms that you just can't explain, then get tested.
Yeah.
Right? And let's get the answers. And then if we had to have more answers, then we'll, pursue it farther. So
Yeah. Do you feel like it's still kind of, and I know that we talked about this in our last podcast, so please go check it out. Another shameless plug.
chlamydia and gonorrhea are the top contenders in the world.
Yeah.
And then now syphilis is, in one report that I read, they said that it was, has increased 1,000-fold.
1,000-fold.
In Canada, in certain parts of Canada. Yeah. People need to be tested.
Yeah.
If they're sexually active, they need to be tested. If you're in a long-term committed monogamous relationship and you were tested before that, or that's your first partner on both counts, then you're okay not to be tested. But if you're having sex with any other person, or you think your partner has, then they need to be tested and rule this out. I've had so many people think they were in a monogamous relationship and find out otherwise. Someone's cheated on them, someone's seeing escorts, somebody's, or thinking that this is a disease of the past and it doesn't exist anymore. It does. And they need to take care of it.
Yeah, and I think that's the thing. It's like we need to just accept that STIs are on the rise, And whereas before there was this kind of hesitation to get tested, it's just like, this is just something that we just need to do and we need to talk about because it's just part of our reality. Like this is just the world we live in where these things exist. And if we're not being, preemptive, then we set ourselves up to possibly be put into difficult situations.
Oh, absolutely. And some devastating situations too. Like, gonorrhea is very devastating for women, and for men too, if it's never been diagnosed, and treated. It can have incredibly bad effects for people.
So what are some of those effects?
So syphilis can affect the other organs in the body if it goes untreated, and it can affect the brain, it can affect the heart, and so it can have neurological effects to somebody. For women, what can happen is that an infection can pass through the vagina, the uterus, the tubes, blocking the tubes and scarring them possibly, and then possibly traveling into the pelvic area and causing pelvic inflammatory disease, which is a chronic pain disease, which is very painful. And so it also can mean that for women, it may not be relevant right now, but it can be when they choose to have children and find out that they're infertile because the tubes are now scarred, and so that they don't have the ability to get pregnant.
So this leads into the next question I got. This is a question I've gotten from first-year university student, and they asked, what should I do if my boyfriend doesn't want to wear a condom? You want to field this one first, Sue?
Run away.
As quickly as possible.
If your boyfriend does not want to wear a condom with you, then he's probably not wanting to wear a condom with other partners he's been with. And so he's putting you at risk. And it's something that you have the right to insist on. Otherwise, it is a form of abuse, really. But I would also say that it wouldn't just be the boyfriend. It can be the partner as well. If the girlfriend says it's okay, you don't need to use a condom with me, then again, it's possible that she has said this to other partners and is again putting her partner at risk. So yeah, it's important, and that's a conversation that you need to have and agree upon.
Yeah, sex is an intimate act, and you need to be talking about it before you actually engage in it.
Yeah,
and so yeah, you need to be. It's showing respect for if you're a woman and he's saying you don't need to wear, or I don't need to wear one, or I don't want to, I don't like it. Well. That means then we're not going to proceed, period. You got to have that conviction in your heart that he's not respecting you enough to want to do what you're requesting. And so that's probably not a great moment in the relationship, one to pursue.
Yeah. This is, again, it goes back to one of the things that we talk about in the S.H.A.R.E presentations about curating healthy boundaries. And that it's a lot of times we don't necessarily know what to say when we're put in those situations, so we just kind of go along with it.
And hormones really take over too.
Yeah, hormones really take over. And so it's important to know what your boundaries are and to know what your lines are. And also to know that it's okay to have those lines. And if somebody were to try to make you feel bad or pressured for your own boundaries that you've communicated, that's a them issue. That's bye-bye. That's a them issue. That has nothing to do with you. Like you are worthy of respect, and whatever boundaries you have in place for yourselves, those are super important.
And like what we talked about in the last episode is that, what you can do is practice with your friends. So, boy says that I don't need to wear a condom. I'm fine. I'm clean. How many times have I heard that? I'm clean, and they've never been tested. You're like, I wonder how you figured that part out. So it's understanding that, everyone does need to be tested if you're sexually active, and that includes oral, as Sue was saying earlier, because so many people do not think oral sex is sex. But having the boundaries to say, and so using role play to help prepare you for those moments, because like I said, hormones take over and your brain may not be working the way. And if you've practiced with your friends or whomever you want a safe person, then it may give you the ability to exercise those boundaries.
That's great. I have one more question. Again, this comes from a student, a high school student. And she asked, what should I talk to my doctor about when it comes to STIs and sexual concerns? What are some general things I should bring up as I begin to enter into like more of like a sexually mature place?
So I would make sure that they are comfortable talking to their doctor, because often if it's been a family doctor and it's the whole family goes to see the doctor, then they may feel very uncomfortable talking to them, and they won't open up about everything that they want to talk to them about. So I would make sure that they have that comfortable relationship with the doctor, that there is confidence, and that confidence is exercised, and it won't be shared with mom and dad if that's what they don't want to have happen. And then it's understanding your body. It's recognizing the signs of your body that are normal to you and what's not normal to you. Often for women, it is unusual vaginal discharge is something that can be a warning sign. Bleeding, having some bleeding between periods can be a warning sign. Not necessarily, that neither of those are for sure, but they can be. So it's recognizing what's normal for you and what's not normal for you.
Yeah, definitely. If you're sexually active and something is just off, that's something to talk to your medical care provider about, or again, coming into Atwell to be tested. For the males, again, can also be unusual discharge, any pain or swelling in the scrotum is another sign. Any rashes, lesions, sores, that sort of thing would definitely be something you want to have checked. So yeah, anything out of the ordinary for you would be a reason to come in.
And say someone says, you know, I don't think I have that doctor I can go to, or I don't really have that person that I can contact. Sue, what is the number here where they could contact you here in Oakville? How and how could they get a hold of you if, say, someone's here in Oakville and wants to like make an appointment?
Yeah, they can either go online at atwell.ca, and that will get them to either one of our clinics. If they are closer here to Oakville, then they can call directly at 289-529-0219, and they'll get our center manager, Pam, and she's lovely, and she will book them in at a convenient time.
And what about Hamilton? How would people contact and get a hold of you, Joe, in Hamilton?
Yeah. So again, they can go through Atwell Centre.ca. They can go on the website. They can book online, or they can call us, and that number is 905-393-8525 to book an appointment. We generally see most of our STI clients in the morning, and that's when our appointments are for that as a general rule.
That's great. Well, I think that's all of the time, again, that we have for this podcast. Thank you guys both for coming on. Seriously, it was so lovely to have you, and I feel like it's so important for just Atwell and the podcast for the voices of our nurses to be heard, and for people listening to know that this is a resource that they can, you know, tap into. So I think we should have a round of applause, Lucy, just for our nurses. Yeah, they did so great. So great.
Thanks for having us.
Thank you.
It was honestly a pleasure. So please, if you are in a situation where you need some help, you need to talk to somebody, these are conversations that shouldn't be saturated with shame or guilt. You know, people make mistakes, and that is okay. Know that you will be supported, and you can find, you know, help and solutions and a place where you can ask all of your questions here at the Atwell Centre and at our clinic and with our S.H.A.R.E program. And we will see you guys on our next episode. Thank you for listening, and please don't forget to share.